Today, you are going to learn how to teach children with asthma how to use their metered dose inhaler, or MDI, and spacer. MDIs have been shown to be the most commonly prescribed device to treat breathing problems, yet they are the most difficult to learn how to use. When using an MDI alone, only 55 to 60% of the medication has been shown to reach the respiratory tract, because a large amount directly impacts the posterior oropharynx. This is why spacers are recommended, as they hold the aerosolized spray, slowing its velocity, so that it can be better delivered to the lungs. Studies have shown that children are not using their inhalers as prescribed, and even when they do use them, they rarely use the proper technique. Furthermore, the rate of incorrect technique among providers has been shown to be as high as 85%, and we do not want you to be part of that group. So, in this video, we are going to show you step-by-step instructions on how to use an inhaler and spacer, and how to convey that understanding to kids. The quality of the first instruction has been shown to directly correlate with better patient outcomes, so we need to do a good job here. Now, before we get into the finer details, here is an outline for your teaching encounter with your patient. Demonstrate the procedure while describing each step. Repeat demonstration without any explanations. Ask the patient to demonstrate the procedure for you. Explain any errors you saw and repeat parts of the procedure as necessary. Ask the patient to repeat the demonstration again. This is our patient X. His name is actually X. Let's pretend X was just prescribed his first inhaler and spacer, and he needs to learn how to use them. As we go through the procedure, we'll highlight steps that have been found to be the most error-prone. Okay, X. The first thing we have to do is get everything ready, and the first step of that is taking the caps off the inhaler and the spacer. And then, we need to get the inhaler ready to use. We call that priming. The patient will need to prime their inhaler when using the inhaler for the first time, having not used the inhaler for more than 14 days, or after dropping the inhaler on the ground. First, you shake the inhaler for 5 seconds. Point the nozzle into the air away from you and press down to actuate the inhaler. Some inhalers have spray counters on them. The counter will show dots instead of numbers when it isn't primed, so keep shaking and spraying until a number appears. If there is no counter, or you're priming because you dropped the inhaler, do it 4 times. Now that it's primed, we need to shake up all the medicine inside. So we need to shake it for 5 seconds. Always for 5 seconds. Now that your inhaler is shaken up, you're ready to connect it to the spacer. The spacer is this clear tube that holds the medicine inside before you breathe it in. And this part is kind of tricky. Before you even put the spacer in your mouth, you have to breathe out all the way. Once you breathe all the way out, you put the tip of the spacer between your teeth, close your lips around it, and as you start to breathe in slowly, you press down on the inhaler. This part will be difficult to coordinate for anyone, especially kids, and will take a lot of practice. Pressing down on the inhaler might be tough for them too, so sometimes they might need to use 2 hands to generate enough force. Watch as a 5-year-old struggles to actuate an MDI with 1 hand, but has more success with 2. So you just sprayed all the medicine in and started to breathe, but you still need to get all that medicine in. So after you press down, you take a big, deep, slow breath in. Okay, X, do you know how to count to 10?
Yeah.
Awesome. So after you breathe in, you need to hold your breath for 10 whole seconds. And when you're doing that, you can leave the spacer in your mouth or out. It doesn't really matter as long as you hold your breath for that whole 10 seconds.
Okay.
Once you count to 10, you did it. You can breathe out now. The doctor will probably want you to do this more than 1 time. So to do that, it's pretty easy because you know the steps already, and you start from the top. Shake the inhaler for 5 seconds. Connect the inhaler to the back of the spacer. the cap's off. You breathe all the way out. Put the tip of the spacer in your mouth. Put your teeth on it, then your lips. And then while your breath is still out, you press down the inhaler as you start to breathe in. Do a nice, big, full, slow, deep breath all the way in. And you can take the inhaler in or out of your mouth, and you hold for 10 seconds. You got it?
Yeah.
Okay. It's tough though, so we want you to practice, alright? So you're going to take these, and you're going to start from the beginning. That was really good, X. Awesome job. I noticed you had a little bit of trouble with a couple parts, so let's practice those again now. So the first thing, before you even connect these two, you have to shake the inhaler. And it's a little step, but it's important because you want to mix up all the medication. And then after that, I thought you did a really good job breathing all the way out and timing the breath with pressing the inhaler. But I noticed you had a little trouble, and that's okay because it's really hard to push these down. So try to practice that two-handed method so you can get both fingers to press down, okay? And then after that, just make sure you hold your breath for a full 10 seconds. I'm not sure if you did a full 10 seconds or not, but next time, try to hold it and count to 10 in your head, okay? Otherwise, you did a really, really awesome job. Now that we've practiced, let's do the whole thing one more time, and then you're done. Awesome. Awesome job, X. You've earned a high five and a sticker when you're on your way out of here. That's it. That's the whole procedure. Following this evidence-based approach will increase medication adherence and decrease asthma symptoms in your patients. Remember that a knowledgeable teacher directly impacts your patient's ability to absorb, retain, and make use of information. And don't forget to include the parents either. They should be just as familiar with the procedure as the patient. And just like with any medication, they shouldn't be using without parental supervision, even if the patient seems comfortable and competent using on their own. And if they ever have any questions, they can feel free to refer to the instruction manual inside most of these devices. Lastly, these are kids. Try to make it fun for them, without compromising the medical information that needs to be taught. Now in your workshop, you're going to be practicing this procedure so that you can solidify your understanding before teaching it with your future patients. Thank you for watching, and good luck.